Hello, everyone. Can everyone hear me? Well, yep,
Yeah.
sweet. So, our first group comprises of four phenomenal women, and I'll introduce them to you. We have Dr. Katie Fusco, Dr. Jessica Vargas, and Dr. Eileen Welsh. And I am Tarisai Githu. And our project, our quality improvement project, is based on translation services. So, yeah, we'll get into it. All right. So, a little intro to why we picked this topic. UCLA Children's Dental Center sees a high percentage of patients with monolingual Spanish-speaking parents. Right now, about 4 out of 14 residents speak Spanish and can easily communicate with these parents. We also have five staff members that are Spanish speaking and can assist in translating if they are available. This comprises of three assistants that are with us in the back and two front desk admin. Depending on the clinic schedule and number of available assistants, it can be difficult at times to find translation. So our big question was, what other translation options do we have? Okay. So the problems identified is we chose to focus on efficiency as our main dimension of quality in healthcare. A second dimension of quality in healthcare can be a byproduct of efficiency, which is timeliness and patient or parent satisfaction. But our main focus was going to be efficiency. Currently, hearing back from residents, they said at times they do get frustrated, well, the non-Spanish speaking residents, as they struggle to find translators when the clinic is very busy. And they feel that the appointments are less efficient with Spanish speaking parents when translation is not available. So by increasing resident satisfaction, we can also improve patient parent experience as well as lower costs indirectly. And what I mean by this is if we're able to have efficient appointments, then we're probably able to accomplish more in those appointments. Per se, if they come in for a recall and we have ample time, we would be able to do sealants. And we know that wasted time has a domino effect. So if we waste time in one appointment and it spills over to the next, then the next patient is not getting the optimal or efficient appointment that they should. So those are thoughts we had. So our aim statement is between the months of January 2021 and March 2021, an implementation of a phone translation service will increase resident satisfaction by 2 points. We chose to measure efficiency by these two variables, the effectivity of communication and efficiency during the appointments time-wise. And our target and our opportunity statement is we want to improve efficiency and timeliness and also decrease resident frustration, increase patient-parent satisfaction, and as a result, improve the perceived dimensions of quality in healthcare, or this specific dimension of quality in healthcare. We will track this by studying resident satisfaction in Spanish-speaking appointments over time. All right, and then Dr. Eileen Welsh is going to take over and continue.
Okay, so our quality improvement team was comprised of 4 pediatric residents and the UCLA phone translation service. We first established a baseline of resident satisfaction levels of translation of efficacy during the appointment. So we had an idea of where we started at and if we were able to make any changes. We used a process map to establish an appointment sequence with the translation phone service in use so that we had a clear map of how our project would work. And PDSA methodology was applied to implement various changes that we made in order to try to affect a change. And our results were analyzed afterwards. So for baseline, as I guess a standard practice that we have in our clinic right now is the non-Spanish speaking residents are currently asking assistants or front desk administration to translate for them. Occasionally, we've all experienced that, at least those of us who don't speak Spanish well. Our appointments are stalled or placed on hold as we find a translator. So that could either be at the beginning of the appointment when we're doing medical history and asking chief complaint. And that could also be again at the end of the appointment when we want to share our findings and establish a treatment plan. And then so before our intervention, you can see that we had a high amount of residents using translators, although we do have some residents who are able to translate just fine by themselves. And a lot of residents did believe this would be beneficial. Okay, so you can see here in our process map, basically it starts, first by greeting our patient or patient and parent, and then we would ask the language preference and the parent would decide which language they feel comfortable communicating in. That kind of set us on two different branches here. So for English, we would proceed with a recall. And then for Spanish speaking patients, the resident determines if they need translation. So for those co-residents that we have that are fluent in Spanish, no translation is needed. So they would just proceed on with their recall. For the rest of us who Spanish is still not a language we speak, we would decide what type of translation we wanted to use. So if a dental assistant was available, we would grab them, proceed with recall. And then if they are not available, we hope to enter this option, the phone translation option. So you had the option to call the translation services. First, you would need to obtain a cell phone, call the service, obtain a Spanish translator on the phone, and then provide to the translator various information about the patient, your building number and name, and then you could use the translator to translate for the appointment and proceed with your appointment as scheduled. Okay, and then this is just an idea of kind of how we envision the translation services in action. So we put these little slips in a very visible, easy to find place. We're always at the computers, and they said, reminded people, if you need translation, here is the translation services phone number, and here are the extensions you need to press, just, to make it easiest for people. And as you can see in this other picture, I am sitting where our parents usually sit. Tari is playing the part of our beautiful young child patient, and Katie's the provider, kind of showing how we envision this translation service in action with a cell phone. Okay, so next we'd like to share just a couple of the visuals from our baseline survey that I think were helpful in showing why we decided to try to do this project. So when you see a patient that's Spanish speaking, how do you go about seeking translation services? You can see the majority of our co-residents use assistant or front desk staff to help them. And then we have this 22.2% that are translating for themselves. So I think that's a really good visual of where we are at in the clinic. This was our word feedback for if you elected any amount of longer appointments or less appointment satisfaction with Spanish speaking parents, please tell us why. And you can see we have people, the time to find translation, difficulty finding translation, assistants being busy. We did have a couple people mentioning they weren't sure how their message came across via translator, which we didn't decide to study that a particular issue in our project. We're more establishing the time or the frustration it took to find translation. But you can see that difficulty in finding translation and time were big things that residents harped upon. Okay. And then so in our baseline survey, there's if a phone translation was more accessible for you, do you believe it will aid in appointment effectiveness and communication? And you can see that. Sorry. Oh, okay. I thought maybe Dr. McBride said something. Okay, so you can see here that a majority of our co-residents actually believe that this would help us in effectiveness and communication of our appointments. So I think people were interested in the phone translation services. On a side note for this, I just want to mention, throughout our survey and our learning process with QI, we realized that, there's a big difference between saying effectiveness and efficiency, which sometimes I think gets a little bit mixed up when you're not careful about thinking about it. So effectiveness being like how successful something is in getting a desired result, and efficiency being literally the time, money, or effort in that performance. So sometimes they do affect each other, and I think that's why a lot of the times we use them together. But in terms of quality improvement, efficiency is definitely a domain in our healthcare quality, just like timeliness and efficiency that ultimately we tried to study with this project. And we didn't really delve, I guess, study wise into how effective our current translation system is, or if using a phone translation service would change our effectiveness. But we did really try to study the efficiency part of it. Um, so yes, and I can let Dr. Katie take over now.
Okay, so we utilize the PDSA Plan, Do, Study, Act methodology for implementing changes with our presentation or with our project. So our first cycle, our change that we wanted to implement was kind of accessibility to this translation service phone number. So our idea was that if it's more accessible or more visible to our co-residents, that it would be potentially more likely that they would use it, ultimately maybe increasing their efficiency in appointments or just effectiveness with another source of translation. So our plan was that we wanted to improve usage of a translation service by implementing signs, which you saw from the photo that Eileen had on the computer, and we'll have a little picture of it on the next slide, by taping them to each cubicle computer. For as far as the planning of that went, like we each all had different responsibilities as far as like who was going to make the card, who was going to post the cards. I know we had them both in Westwood and Venice. So between the four of us, we all kind of divvied out those responsibilities to execute our plan. As far as the do, so what were we collecting? We wanted to see if this specific PDSA would increase usage of this phone service, with it being more accessible on the computers. So from this specific PDSA, what we're studying is that we wanted to figure out what did we learn from this. That's the study aspect of, we're analyzing our results, comparing them to like what we predicted, our predictions where we thought that it would increase usage to ultimately make clinic and appointment times more effective. And what did we learn? So it did match our predictions, and we'll kind of go a little bit more in details in the next slide. Obviously, if something is more visibly readily available, they might be more inclined to utilize to see it fit, but it is also difficult to change habits. So we know that even if we're putting things in front of people's faces, when we're busy on a Thursday seeing a lot of patients, there's a lot going on, it might not be like our first thought to be looking at the translation service number. So we know that it is a little hard. So we did want to adapt this change into continuing with our QI project by keeping the phone numbers posted. We didn't think that taking them away would benefit. We thought that by keeping them there, it would definitely help. So this was our objective. Like I said, increase in visibility, decrease difficulty in assessing number to improve the usage. That was our change, was when we posted them on the 23rd of January. We said that our prediction would increase usage, and if the contact number and instructions on how to contact was accessible and visible. So on the day we posted the phone numbers after clinic that day, no one had used the translation service. But after about a week of having them there, we did notice that 3 residents had reported use throughout the week. So we did see a slight increase. For our second change, we were just trying to think of what are other ways we can kind of implement this and get more awareness of our translations phone service number. So we wanted to do this by more verbal weekly reminders. This was our change that we were making in improving awareness. So we were going to be reminding our co-residents during our chief rounds of the translation service option to use during clinic, not necessarily to eliminate using a dental assistant, but also just as an additional option if you find yourself struggling or running around looking for someone. Again, we wanted to tally residents at the end of each week to kind of see how their usage was with the phone numbers, if the weekly reminders were helpful, if it didn't make enough difference. We noticed from what we did see was that the weekly reminders didn't really improve utilization as much. I think with posting the picture and like the card at first, it kind of brought significant awareness right away. And then the reminders, it might have just kind of added to like the laundry list of reminders that we had during chief rounds, because we do get a lot of information during those times. So maybe altering when we were giving verbal reminders would be how we would act upon this change that we implemented. So again, we wanted to increase the frequency. The change was to remind co-residents of translation services during our chief rounds at 12:30 Mondays. We figured if there were more reminders, there might be more likely to utilize this translation phone number. When we implemented them a week, by the end of the week, one resident had reported use. And when we surveyed them or tallied them at the following week, after we had also reminded them on the Monday, again, only one resident had reported use. So it didn't really show much of a change. For our third cycle, we had the idea of maybe if we were anticipating our patients that were Spanish speaking, we could be better prepared to use our translation phone service. And there could potentially be more residents utilizing that option for translation. So we can go into the details on the next slide, but we advised residents of if they were seeing a Spanish speaking patient in their column on a specific date, and asked them if they utilize the translation service prior to seeing the patient. So if having that information at the beginning of the day was helpful and to them being like, instead of kind of rolling the 8 ball, not really knowing whether or not they're bilingual or if they only speak Spanish, by maybe utilizing having the phone ready to go beforehand. We did notice with this PDSA, unfortunately, it did not increase usage of translation service and or resident satisfaction. So we will not continue to advise residents of upcoming Spanish speaking patients. I think this got cut out somewhere, but just because I think it was nice for them to know, but I just don't think it gave them like an absolute to utilize the phone service. I think it was just more of like a nice reminder that they may need to use translation throughout the day, but I think that using the assistant might have been like the more convenient option. And it was, again, difficult to break habits. So it might have just been kind of something that it was on a Thursday that we implemented this, which is also a busy day. So again, this was the change that we were trying to make, notify residents with Spanish speaking patients in advance. And our prediction was maybe that giving providers the opportunity to obtain the service prior to meeting the patient, it would increase appointment satisfaction. So on this specific date, we had tallied that 11 Spanish speaking patients were coming to our clinic, and the affected providers were notified. And at the end of the day, we tallied if they were more likely to prepare with a translation service ahead of time, and 0 reported that the advance notice impacted translation service use. So I know we talk about, like Robin had mentioned this like in our classes before, that quality improvement is something that we ultimately want to have an improvement on, and we want to show success and stuff, but also it is showing the things that aren't successful. So you do know how to kind of keep making PDSAs and keep going with changes to make a successful project and overall improvement. So this was our initial thoughts that we thought would be improving, but ultimately we either saw stagnant improvement or none. Eileen?
Okay, so this is our run chart. As you can see here, we have resident satisfaction on a scale of 1 to 10 and our survey results over a period of time. I just want to make sure we emphasize why resident satisfaction. It does fit into the quadruple aim, which is basically improving the triple aim of healthcare by incorporating the clinician experience, which is supposedly going to synergistically improve the other aims. And I think as clinicians, we could all agree that our experience is important to the overall experience of healthcare and that our patients get. So here we aim to improve that fourth aim, which is going to impact the other aims such as better outcomes, improve patient experience, possibly lower costs like we touched on before. We chose resident satisfaction as a question to try to obtain quantitative data. Again, possibly, and we'll touch on this on the end, measuring minutes of an appointment may have been a better indicator of appointment timeliness and efficiency. But we just felt at the time that it was going to be difficult for us to do that due to each patient and each appointment kind of taking a different amount of time, translation aside. So because of patient or parent questions, depth of treatment plan, radiographs needed, or calculus, all our appointments are individual and variable. So anyway, we have resident satisfaction. As you can see here, our baseline score was 7.2 for resident satisfaction when they had to get translation for Spanish-speaking patients. As you can see here, on the 24th of January, we implemented the postcards on the computers. And you can kind of see at our next PDSA, which would, our next survey result, which would show any kind of progress from our first implementation. We had 8.2. Again, some time had passed between these, so we didn't really think it made a huge difference in the results, but there was a little bit of a bump there. We started reminders during chief rounds at this time, and to our next survey results, you can see that there wasn't a improvement after those reminders during chief rounds. At this point, we decided to implement a pre-planning for Spanish-speaking patients. And our final survey that we took really didn't show any changes or impact from that, that intervention. So as you can see here, we didn't improve resident satisfaction by implementing the translation services like we had, I guess, hypothesized, you would say.
All right, so moving along to the results and metrics. First, I'm going to mention some resident commentary that we were able to gather. So one resident said, "I think I haven't used it because I keep forgetting that it's an option, but I think it's a great resource to have available." Another resident said that they were a native Spanish speaker, have not used, but I do like the option, especially for other languages. So basically what we found out was that this translation service was used when absolutely no one else was available to translate. And it also helped in a pinch, but is not more convenient as opposed to physically asking someone that is available in the clinic to translate. As Eileen mentioned previously, the baseline satisfaction was 7.2. After PDSA number 1, it was 6.4. We saw an increase to 8.2 after PDSA number 2, and then an unfortunate decrease after PDSA number 3. Overall, we found out that it appears that residents were very supportive of the idea of having a translational phone service, but most ended up not utilizing it because they either forgot about the service or they were able to find translation services in another way. Some considerations. So how exactly does resident satisfaction align with the dimensions of quality care? Resident satisfaction is directly related to the dimensions of quality care that our quality improvement project was geared towards. In our project, we focused on efficiency, which in turn has a byproduct of timeliness. When residents are able to communicate effectively with their Spanish-speaking patients, they are happier and more satisfied with the course of the appointment. Defeating a language barrier provides efficiency and timeliness, ultimately improving quality of care. Why would consistency and patience change behavior or lead to improvement breaks and old habits, or improvements or breaking old habits? Should we have tested the reminders more or different ways? And our response to this was, patience would be difficult to quantify and to measure. We could have potentially tested the Pivotal service by using a phone translator solely for a clinic session or sessions. And also, we could have sent daily reminders during morning huddles at 8 a.m. However, we only sent reminders usually once every 2 weeks. Ultimately, we did find this as an improvement, and we found out that although we didn't have the most ideal outcome because many residents did not utilize the translation service, or they found it a little bit tedious to utilize, we added another tool in the toolbox of communication between our residents and patients. An improvement does not mean everything is perfect, but our translational situation has definitely improved. Also, although we focused our project on Spanish-speaking patients, the translation service has a variety of other languages available that can suit future patient and provider needs. Just to chime in on this last comment, I actually had a patient that is an embassy patient and they speak Arabic. They actually brought in their own translation service on their phone, and I was able to communicate with them effectively with that translation service. I found it very helpful, but at times I think that certain dental terminology that I was trying to express to the patient, although I tried to put it in layman's terms, was maybe a little bit misconstrued with the translation service. But ultimately it was more effective than not having any type of translation service at all. And I definitely can see myself using this type of service in the future for. Did someone ask a question?
No, I think there was like an echo. I think you're fine.
Okay, no problem. But yes, I can definitely see myself utilizing this phone translation service in the future, especially for patients that do not speak English or Spanish. One other consideration, so why did we not consider the patient's experience in all of this? Ultimately, when we took a step back to kind of look at the project, we realized that we probably should have prioritized the patient and parent satisfaction over resident frustration. And this stems exactly from one of the 6 dimensions of quality in healthcare, patient-centeredness. Some lessons learned here. So resident satisfaction is not an effective indicator nor easily studied or surveyed. There are more effective indicators that we could have used. Hypothesizing that adding translation phone services as an option would reduce the time it would take to find and or wait for the availability of an assistant or administrator. We could have provided some more reminders regarding the availability of the translation service, and this could have potentially been helpful in providing us with more final feedback from our residents. We could have also examined the schedule ahead of time to determine the need for translation services and whether or not we would have assistants available to help translate. Also, it could have been helpful to text the contact information for the translation service to the residents to potentially increase the usage of the translation service and decrease any barriers that presented. Also, we could have reminded the residents about the phone translation service during all morning huddles as opposed to just some. Some take-home points here. So of course, there is a learning curve with any quality improvement project. There is definitely a challenge that was somewhat resolved in another to be tackled. So pretty much when you fix a problem, you usually end up finding out that there's more problems to be solved as well, which is great because we were able to use the PDSAs to discover new ways to try to tackle any barriers to overcoming our quality improvement project. It's also very difficult to break old habits, but consistency and patience is key. And to increase efficiency of phone translator use for data analysis, we may have limited translation options. And also the assistant and or provider translation services are preferred by residents to phone translation services. However, to increase efficiency in appointments, when the assistants or any administrators that can speak Spanish are unavailable, the phone translation service is very useful for the residents. In conclusion, we have not necessarily changed resident satisfaction for appointments with Spanish-speaking patients, but we have introduced an alternative that works. And with that, we say, gracias por su atención.